If you walk into your doctor's office and the nurse wraps that cuff around your arm, pumps it up, and announces with a smile, 110/70, perfect. And if you are over 75 years old, I need you to stop celebrating, and I need you to start asking questions. For 40 years, we have been brainwashed by a single number, 120/80. We are told that this is the Holy Grail. We are told that if you hit this number, you are safe. If you go above it, you are in danger. But what if I told you that for an older adult, specifically someone with stiff, aging arteries, forcing your blood pressure down to 120/80 might actually be increasing your risk of a fall? It might be starving your brain of oxygen, and in some cases, it might be shortening your life, not extending it. I am Dr. Oleksii Kalmykov. In my internal medicine practice, I treat the patient, not the number. And I have seen too many seniors end up in the emergency room with a broken hip because they were over-medicated to hit a target that their body simply could not handle. Today, we are going to have a very serious, very honest conversation about the real truth of blood pressure after 60. We are going to look at the physics of your aging blood vessels. We are going to discuss the silent drop that happens when you stand up, a condition called orthostatic hypotension that most doctors forget to test for. And we are going to look at the research, from the SPRINT trial to the latest geriatric guidelines, that suggest the Goldilocks zone for a senior might be higher than you think. If you have ever stood up and felt the room spin, or if you feel tired and foggy despite having perfect numbers, this video is the prescription you actually need. Let's start with the basics. Why does blood pressure rise as we age? Most people think high blood pressure is just a disease, but often it is an adaptation. Imagine a garden hose. When you buy it new, it is green, rubbery, and flexible. If you turn on the water, the hose expands to handle the pressure. The flow is smooth. Now imagine that hose sits in the sun for 50 years. It becomes hard. It becomes brittle. It turns into a lead pipe. This is your arterial system. As we age, the collagen in our arteries stiffens. We get calcification. The vessels lose their elasticity. Now think about physics. If you need to push water through a flexible hose to get it to the second floor of a house, you need normal pressure. But if you need to push water through a stiff, narrow concrete pipe to get it to the second floor, you need higher pressure. If you artificially lower your pressure in that concrete pipe too much, the water simply doesn't reach the second floor. And in your body, the second floor is your brain. This is the first danger of aggressive treatment, hypoperfusion. If we force your pressure down to 110 or 120 and your arteries are stiff, we might not be generating enough force to push the blood against gravity up into the capillaries of your brain. This presents as brain fog. It presents as forgetfulness. How many seniors are diagnosed with early dementia when in reality they are just over-medicated? Their brain isn't dying, it is just thirsty for blood flow. Now I want to talk about the single biggest risk to your independence. It is not a heart attack. It is not a stroke. It is a fall. A hip fracture in a person over 80 carries a mortality rate that is terrifying. If you break your hip, your life changes forever. And what is the #1 cause of fainting and falling in seniors? It is the sit-to-stand issue. In medicine, we call this orthostatic hypotension. Here's how it works. When you're sitting in your favorite chair watching TV, your blood pools in your legs and your gut. When you stand up to go to the kitchen, gravity immediately pulls more blood down. In a young person, the body has sensors, baroreceptors that scream, "We're standing up, squeeze the vessels." The heart beats faster, the vessels clamp down, and blood pressure stays stable. But in an older adult, those sensors are slow. They are like an old thermostat. You stand up and the sensors don't react fast enough. Gravity wins. The blood drains from your head. Your pressure might be 130/80 when you are sitting. But the moment you stand, It crashes to 90, 60. The room spins. You grab the sofa. Or you don't grab the sofa and you wake up on the floor. If you were taking 3 different blood pressure pills, a diuretic, a beta blocker, and ACE inhibitor, you are forcing your system to stay relaxed. You are preventing the body from mounting that rescue response when you stand up. So when your doctor measures your blood pressure, how do they do it? You sit quietly. You relax. They take the measurement. 120/80, Mrs. Jones. Keep taking your pills. But Mrs. Jones lives her life standing up, walking, and moving. Unless your doctor measures your blood pressure while you are standing, they're only seeing half the picture. I want to look at the research, specifically the SPRINT trial. This was a famous study published in 2016. It was a massive headline. It said, "Lower is better." It suggested getting pressure down to 120 reduced death rates. But here's what the headlines didn't tell you. They excluded people with diabetes. They excluded people with a history of stroke. And critically, they excluded people living in nursing homes or those with severe frailty. When we look at other studies, like the one published in JAMA Internal Medicine, which specifically looked at frail older adults, the results flip. In frail seniors, those with lower blood pressure actually had higher mortality rates than those with slightly higher pressure. Why? Because a slightly higher pressure, say 140/80, provides a safety buffer. It ensures the brain gets fed even if the pump is a little weak. It prevents that crash when you stand up. So what is the Goldilocks zone? What number should you actually aim for? Now, please listen to this disclaimer. I am a doctor, but I am not your doctor. Do not stop your medication today. That is dangerous. This is a conversation for your next appointment. The American Geriatrics Society and recent guidelines suggest that for a robust, healthy 70-year-old, 130/80 is a good target. But for someone over 75, or someone with frailty, or someone who has had a fall, 140/90 might be perfectly acceptable. In fact, it might be safer. We need to stop fearing the number 140. If you are 82 years old and your pressure is 142/85 and you feel great, you're walking, you're thinking clearly, adding another pill to force it down to 120 is not health, it's vanity. It's treating the chart, not the human. So how do you know if you're in the danger zone? I want you to perform a test at home. You'll need a helper or a family member. This is the at-home orthostatic test. Step 1. Lie down on your bed or sit in a comfortable chair for 5 minutes. Relax completely. Take your blood pressure. Write it down. Let's say it is 130/80. Step 2. Stand up. Wait 1 minute while standing. Do not hold on to the table if you can avoid it, but stay safe. Take your blood pressure again while standing. Step 3. Wait 2 more minutes, total of 3 minutes standing. Take it a third time. Here's the math. If your top number, systolic, drops by 20 points or more, or if your bottom number, diastolic, drops by 10 points or more, or if you simply feel dizzy and lightheaded, you have orthostatic hypotension. Even if your sitting pressure is normal, your standing pressure is crashing. If you see this drop, you need to take that piece of paper to your doctor immediately. You say, "Doctor, look, when I stand up, my pressure crashes. Do I really need all these medications?" This is called de-prescribing. It's the art of removing medication to improve health. Sometimes the best thing a doctor can do for a senior patient is to take a pill away. Maybe we cut the diuretic in half. Maybe we remove the calcium channel blocker. Suddenly, the dizziness goes away, the energy returns, the dementia clears up. Why? Because you stopped fighting the body's natural adaptation. Now I want to address the fear.
I know many of you are thinking, but Dr. Kalmykov, if I let it go to 140, won't I have a stroke? Stroke risk is real. We do not want your pressure at 180. We do not want it at 170. That's the danger zone. But the difference in stroke risk between 130 and 140 in an elderly patient is very small compared to the immediate risk of smashing your head on the bathroom tile because you fainted. We have to balance the long-term risk, stroke, with the short-term risk, falling. As we age, that balance shifts. When you're 40, avoiding a stroke in 20 years is the priority. When you're 80, staying on your feet today is the priority.
There is also the issue of the kidneys. Your kidneys are filters. They need pressure to push the blood through the filter. If you have chronic kidney disease, which many seniors do, and you lower the pressure too much, the kidneys stop filtering. Creatinine levels spike. I have seen patients go into kidney failure not because of high blood pressure, but because their pressure was pushed so low, the kidneys essentially dried up. So, what is the action plan? Number 1, get a good cuff. Do not use the wrist cuffs. They are notoriously inaccurate. Get a cuff that goes around your upper arm. Number 2, measure at different times. Measure in the morning before pills. Measure in the evening. And critically, measure when you feel funny. If you feel dizzy, check it then. That is the most valuable data point. Number 3, the conversation. Next time you see your GP or cardiologist, ask them this specific question. Doctor, given my age and my arterial stiffness, what is my individualized target? Are we treating me like a 40-year-old or like an 80-year-old? A good doctor will appreciate this. They will look at your chart again. They might say, you know what? You are right. Let's ease off the lisinopril. Number 4, hydration and salt. If you have the drop, if you have orthostatic hypotension, you might actually need more salt and water, not less. We tell everyone cut the salt, but if your pressure is crashing when you stand, a little Himalayan salt and a big glass of water can expand your blood volume and keep you steady. We have to stop treating the human body like a machine on an assembly line. You are not a statistic. Your stiff arteries are a battle scar of survival. They require a different operating pressure. Respect that physiology. If you are watching this and you are caring for an elderly parent, please watch them when they stand up. Do they hesitate? Do they grab the chair? Check their standing blood pressure. You might solve a mystery that has been plaguing them for years. I'm Dr. Oleksii Kalmykov. We believe in precision medicine, not cookie-cutter medicine. We do not accept falls as inevitable. We prevent them by being smart. If this video helped you understand your numbers better, please share it. Send it to your family group chat. Hit subscribe, because in the next video, we're going to talk about the cholesterol myth and statins after 70, another topic where the rules change as we age. Stay steady, stay strong, and keep your pressure where it belongs, high enough to feed your brain and low enough to keep you safe. I'll see you in the next video.